H. pylori is a bacterium that can be found in the stomach and in the duodenum. It is responsible for stomach ulcers. The bacteria's spiral shape helps them to wind their way into the stomach's mucous lining and can live in the stomach for many years. When the bacteria lodge in the stomach lining, they start to produce substances that thin and weaken the protective mucus. This allows gastric acid to reach the stomach's wall and cause damage. Ulcers can develop in the exposed lining as a result. H. pylori infection causes more than 90% of duodenal ulcers and 80% of gastric ulcers. H. pylori can also attach to the stomach cells. This sometimes results in issues like stomach inflammation, gastritis, or excess acid production. Clinical studies have linked H. pylori infection with an increased risk of developing certain stomach cancers. H. pylori infection is a common, chronic infection found throughout the world. 2/3 of the world's population is infected with H. pylori. In Pakistan, it is estimated that 80% of the population have H. pylori present in their stomach. Normally, a person can get this bacterium through saliva, fecal matter, or oral contact with contaminated water or food. However, the way it's transmitted is still unknown. Many times, people who are infected with H. pylori don't experience symptoms. If they do occur, they can include abdominal pain, nausea, loss of appetite, heartburn, stomach burning, bloating, gas, weight loss, vomiting, and gnawing pain. Diagnostic tests can sometimes be painful, messy, or time-consuming. When our healthcare providers suggest that we have some kind of testing done, we don't always know if there are other options available to us. When trying to rule out H. pylori infection as a source of your stomach symptoms, there is a test that is easy and convenient. Otsuka Pakistan Limited has launched the Made in Japan, US FDA-approved gold standard urea breath test system in Pakistan. The Otsuka Urea breath test system diagnoses and confirms the presence of H. pylori in the stomach. How the urea breath test works? The human stomach is normally devoid of the enzyme urease. All H. pylori strings produce urease, which cleaves urea into ammonia and carbon dioxide. Thus, detectable activity in the human stomach is likely due to this bacterium. Urea can be labeled with a non-radioactive isotope, carbon-13. Carbon-13 labeled urea is given orally in the form of a tablet as part of the urea breath test system for H. pylori. In the presence of H. pylori, carbon-13 labeled urea is degraded by the bacteria urease. The labeled carbon dioxide then equilibrates with body fluids traveling through the bloodstreams and is ultimately expired from the lungs into the breath. The breath test, UBIT, measures this chemical change and provides similar accurate results pre- and post-treatment, so it can be used to confirm eradication. This test is one of the mainstream tests that are highly accurate and simple to conduct. It is considered as the gold standard, non-invasive test for the diagnosis and confirmation of H. pylori present in the stomach. The urea breath test, UBIT, for H. pylori has excellent sensitivity of 97.7%, specificity of 98.4%, and accuracy of 98%. Ask your doctor today about this novel breath test that can help you identify and rule out H. pylori infection as the source of your stomach problems. The Otsuka Urea breath test system is now available and operational at Aga Khan University Hospital in Karachi, Liaquat National Hospital, Karachi, Dow University Hospital, Karachi, South City Hospital, Karachi, Medicare Hospital, Multan, Doctors Hospital, Lahore, Liver Clinic, Lahore, Mia Sajid Nisar Clinic, Lahore, Shifa International Hospital, Faisalabad, Shifa International Hospital, Islamabad, Islamabad Gastroenterology Associates, Islamabad, and Orash Hospital, Ahmedabad.